Hi, how are you doing?
Good. I'm glad you're awake. I was a little bit worried at 2:30 in the morning.
Yeah, it's too early here, but it's a great conference, so
Yeah. Are you
I
ready?
look forward. Yeah, of course, I'm ready.
Okay.
Can
Right.
you see me? Can you hear me well?
Yes, I can hear you. I'm just going to introduce you.
Sure.
I think we've got a few people online already.
Hmm.
Hello, everyone. This is the next session with Dr. Ruchi Pathak. She's the Reconstructive Healthcare Solutions Director. Um, Dr. Ruchi Pathak began her professional career as a dental surgeon and specialized in oral and maxillofacial. She got interested in applications of medical 3D printing for her patients and did her PhD on this topic. She has been a speaker and has authored books, including the fundamentals of medical 3D printing technology for medical and dental professionals. Ruchi is joining us live from the UK, so it is past 2:30 a.m. for her there. So now that is dedication for you. Over to you, Dr. Ruchi.
Thank you, Mitch. Thank you very much. And thank you, Women in 3D Printing, for this amazing conference that we have. And we're having it consecutively for the second year. And I just love this platform. So before I begin my talk, let me just share my screen. Can you see my screen? If you could confirm me that.
You can see your screen. You might want to maximize it.
Yeah.
Yep, yep,
Yeah.
it's
Can you
fine.
see that?
Yes, that's great.
Okay. Okay. So, good morning, good afternoon, and a very good evening from wherever you are in the world. I am Dr. Ruchi Kaul, and I am from the UK at the moment, and it's 2:45 a.m. early morning, but happy to be here. And today I'm going to talk about theory to theater, the drivers and barriers in 3D technology adoption. So, why are we even talking about the drivers and barriers? Well, just before the session, you heard about the panel discussion. I think it was a little bit about the barriers which are stopping 3D printing to move across the healthcare industry specifically. So I'm here to address them, and I did a little research on that. And let me share my journey with you, and I would love to hear more from you. So the agenda for this talk would be an introductory medical 3D printing market research, and then my concept of theory to theater. I would talk about 3D printing versus medical 3D printing because I find these two are very different in terms of one element, which I will be discussing. A year long study that we conducted over the pandemic, the process, the method, and the results of the study. And finally, why are we here? The way forward. So let's begin this journey. So, the global healthcare market in 3D printing is supposedly 20.1% of CAGR. It's growing very fast. It is supposedly expected to reach $5,846 by 2030. This was one of the reports that I got from the internet. I'll share another one with you, which said that it is estimated that the medical 3D printing market size is 26 million by 2026, which means it's growing at a CAGR of 18%. And then there was another report which said that there is a $4.5 billion estimated by 2026 with a CAGR of 36% from 2020 to 2026. Now, why am I even sharing this research? Well, you'll be hearing a lot of talks over the next 2 days, and you would have heard them from the past few hours about how this industry, specifically medical 3D print, especially 3D printing, impacting different industries like automobile industry, architecture, automobile architecture, and all of the other industries which are related to engineering. However, in medical science, the impact is huge, the potential is huge. But this industry basically started somewhere around 1980s. And today it's almost 40 years. We are in 2022 at the moment. So, with this journey of more than 40 years, Where are we in terms of healthcare from the theory to theater? So I'd like to ask you three basic questions, and if anybody could type the answers on the chat box. The first question would be, what do you think is the pace of development of healthcare industry with respect to 3D printing? Whether do you consider it fast or slow? My second question would be, how do you think was the impact of COVID-19? Was it positive? Was it negative? And what do you think about the penetration and application of this industry? Do you think it is faster or do you think it is slow? We've passed 40, 42 years now with this particular field. And what I feel is, if I talk about the theoretical development of this industry, it started from 1982. And in these 40 years, I see very few surgeons directly involved with medical 3D printing. So let me show you a study which was done long back. And in this study, Dr. Charles B. Wilson, he elaborated that there are always 5 stages of adoption of innovation or any new technology. This was basically for robotics. It showed that there are these early innovators who actually adopt technology very fast. These are 2.5% of the people. Then there are the early adopters, which are 13.5%, and following which come the early majority, which is 34%, and then it is the late majority, which is 34%, and then are the laggards, which is the 16%. So, with this kind of curve going for a diffusion of technology, which is an S shaped curve, at this present moment, even the Gartner's chart kind of predicts that we are at the tipping point. We are at the tipping point of adoption, which is 10 to 20% of adoption. There was another study which was done which said it's only 10% of the surgeons or the doctors or the medical professionals who are really adopting this technology. So, why is this happening? Well, I would like to present my purview of 3D printing versus medical 3D printing. Though it is the same technology, but when the term medical is added, I feel one component increases over another. So, if I talk of 3D printing, I feel that it has three components, which are materials, software, and the hardware. And together they form the envelope, they form an envelope which is called 3D printing. And by tweaking these three elements, we can create different objects, and that is what it is about. But when medical is added to this, then there is a medical advocacy which is involved. There is a clinical perspective which is involved. There's a lot of regulatory stuff which is involved, which relates to the medical perspective or the clinical perspective. And therefore, now we have these four elements together, which means the software, hardware, material, along with medical advocacy, which I mean says that we need to involve medical professionals in this technology to make it move faster. Now, let me talk a little bit about the background. Now, medical 3D printing basically involves solving problems for patients. So, surgery at its inception involves innovation and development of ways which are unique to every patient for patient benefit. Now, surgical research that plays a very important role, and even Nina talked about it, that research and collaboration. So, surgical research plays a vital role in bringing innovation from theory to theater. Now, there was this study which we carried out to address the barriers and the drivers and helping adoption of 3D printing technology. Let me talk a little bit about the study. So, what we did was we took 58 interviews in a span of 1 year from 12 different countries. The study and the interview involved surgeons, researchers, entrepreneurs, and engineers. And the entire interview sets were recorded as a part of Surgeons in 3D Printing podcast, which can be found on different platforms. I was the host to the podcast, but this study concluded something which was really important. We found most of the interviews from Asia, North America, Europe, Of course, there were very few from Australia and South America, which we would cover in the times to come. Then we covered a lot of point of care centers, which included the 3D printing centers. We talked to different individual surgeons. We talked to engineering 3D printing research unit heads, to the entrepreneurs of startups and established companies, the non-profit organizations, all of them which were working for 3D printing, and the regulators. The point of care centers which we talked to included Mayo Clinic, University Hospital Basel, Tel Aviv Medical Center, Galilee Medical Center, Cartis in the United Kingdom, Nationwide Children's Hospital Columbus, SJD Hospital Barcelona, Specialized Children Hospital Poland, Amrita Institute of Medical Sciences, Kochi, India. And the non-profit organizations which we talked to included Makers Making Change Winnipeg, Canada, Enable Handprints Glasgow, Women in 3D Printing, AR/VR Association, and the ASTM. Various industry people that we talked to included Realize Med, Johnson & Johnson, Axial 3D, Denteach, Bone Easy, Xavier Bionics, Eyenov 3D, Dental Ceramics, 3 Degrees, Stars, and there were a few more. The results that we got from this was that 90% of the surgeons started using technology in the last 10 years. And actually in the last 5 years, most of them were using it for the last 5 to 6 years. And the primary trigger for using technology for 95% of interviewees was because of the surgical outcome, which improved drastically, and the professional benefits that they achieved. 50% of interviewees acknowledged cost and infrastructure as the barrier for penetration of technology, while remaining perceived learning curve to be a potential barrier. So, all in all, cost, infrastructure, and learning curve were the potential barriers. 20%, now this is an important point, 20% of surgeons preferred to work with engineers, only 20%, or in collaboration with industry, while 80%, mind it please, 80% preferred to work with trained medical professionals due to better understanding of medical concepts. So, as I said, with medical 3D printing, surgeons prefer to work with medicine. Research and collaboration needs to be propagated across different specialties to foster greater acceptance and learning and implementation of medical 3D printing as a technology. Now, this study can help surgeons, stakeholders, policymakers understand the development of point of care centers at world class institutes and replicate their model for creating state of art centers. Now, my journey to this maze started in the year 2012 with medical modeling. In 2015, I was doing guides, surgical guides. By 2016, I started my research and my PhD on medical implants, titanium implants. By 2018, actually, I got into business, into industry. 2019, I also started a podcast and then wrote a book. And then it's just going on with different things that are happening. So, where do we go from here? From here, I would like to say that the research is going on. We are still recording podcasts. So connect with us for sharing your expertise on medical 3D printing, your products and services on medical 3D printing, your research on medical 3D printing, because that will bring to the world what we have in this industry, especially to the surgeons, especially to the medical professionals. And that's how we'll grow together. Second, I would say connect for collaborative works or talks and medical 3D printing. And the third is, I would say, connect for medical advice on product development related to medical 3D printing. So, in all, connect. And that's my thank you very much. I'm open to
Thank you,
questions.
Ruchi, for your interesting talk. So if anyone's online now, it will be great if you can post your questions and answers on the right-hand panel or the Q&A panel on the right-hand side. I have one for you, Ruchi.
Yes,
one of your presentations, you mentioned that 20% of surgeons prefer to work with engineers because and 80% prefer to work with people from the medical background. And it is quite a challenge because, as you can imagine, engineers, I mean, I'm not saying all engineers, but potentially engineers would have a little bit more knowledge of additive manufacturing. How do you think, as a surgeon and someone from a medical background, how do the engineers bridge that gap between getting more medical professionals to collaborate with engineers and really work on knowledge transfer in that field?
Yeah, that's an amazing question, and this question was asked to me in another conference which I gave lately. And what I would say is that what this means to a doctor is, now if I have to communicate with an engineer, okay, so it's better for me to communicate with a doctor because that makes my life easy. So that was the reason I said that medical 3D printing
Mm.
involves one another person who would be the communicating link to the surgeon and to the engineers. And this person has to bring to the table their expertise, not with depth of knowledge in terms of designing, but knowing the anatomical details, knowing the anatomy, and knowing the medical aspects, so that this can be communicated to the engineer. Because I very well know that engineers will anyway know designing better than the medical student, because the medical student will have spent all the life learning medicine, right? So obviously the designer is going to know that better. But then when you have this one of the medicine person as a link between the surgeon who's going to operate, because of less time those that the surgeon has, that always is of value.
Okay, thank you. We have a few other questions on the Q&A panel. Rachel Anfields just asked, how do you think established 3D printing companies can break into the medical space?
Okay. I feel that they need to get in medical advisors in the form of people who know, who have the medical knowledge, well, are getting into industry, or the researchers who have the medical knowledge and are getting into industry. So those are the kind of people, the PhDs, the people from medicine industry, because you have to have these people bridging with the engineers and the doctors, because it makes the life of a doctor very complex, very difficult, and it takes more time for them to relay all the information to an engineer who's just starting out. It becomes really difficult. And that, I think, is one of the very important reasons of why a surgeon would not come out of their conventional surgeries. I'm not talking about the first 10% of the surgeons in the cities, definitely not the first 10%, but definitely we have to spread this technology to grassroots levels to really benefit people. And so for that, I feel that yes, there has to be a bridge there.
Mm, okay. Another question we got from Carol McDonald. Do you think that the pandemic has helped to break the barrier?
Well, I did ask this question. So the pandemic did help to break the barriers, although the financial impact of the pandemic was such that elective surgeries were all postponed. So the financial outcome was not much, but in terms of penetration, it definitely helped, because we
Okay.
didn't have PPEs, we didn't have so many things, and there was a lot which was made at the point of care centers, and so people came to know that there's this thing called 3D printing, which probably back before the pandemic, if you see, it was even difficult to come to this point. So it definitely accelerated the growth.
Okay. Um, Coming from an industry background, I find that certain, and this is more my own general observation, that when I talk about 3D printing to professionals, they always associate that to, the gimmicky desktop printers, to get step out that mindset and take 3D printing or additive manufacturing seriously. Do you think that in the medical space, there is a little bit more, they see 3D printing as gimmick, or do they prefer the word additive manufacturing, or they think that it's all is just all the same?
Okay, so now this kind of divides the world into different sections, like the developing world and the developed world. Because what happens with that is, when you have all the things ready to kind of serve, and cost is not a factor, then there are people who take it up in a different manner. Whereas in the developing world, where cost is important, what happens is you don't want to listen too much about it, because because there is a lot of huge amount of cost which is involved, and to balance on that, I feel the medical sector kind of takes it like very lightly. They don't want to hear much about it, and you really have to work hard on that, and that is something you have to really convey the message in the correct manner. And that's the reason I said you really need somebody from the medical portion of the world, somebody from among the people of the healthcare professionals who's going to bring your product out to the market,
Mm,
because that really adds a lot of value, because you listen to like-minded people.
okay. We have a question from Nina Matthews. Thanks for the great talk, Ruchi. Any ideas how we could make 3D printing more accessible to the general practitioners and allied healthcare, such as physio or occupational therapists?
Yeah. So if this is Nina, because she just gave a talk, I loved her panel discussion. That was amazing. And thank you so much for the compliment. I would say that we need to really get into collaborations. Collaborations in terms of not only expressing our views, but also in terms of different projects being done in different parts of the world, but yet being a part of the same project. So those kind of collaborative approaches will really help this to move further.
Okay. Another question from Carol. Carol is, thank you for all your questions. What's the other question she had was the materials for the surgeons. Are you talking about the materials that can be used internal to the body or only external to the body?
So it's either ways. Basically, I was talking about materials here which we relate to implants, because we use titanium, we can use PEG, but the thing is that for models we can use different materials. So those become the external ones. We can use different materials for organs, and now we're getting into silicon, and so many different materials, and they're very expensive. And so we also need to have that knowledge of what kind of materials would be of use. And so and so that takes us like into the material world, which is a part of 3D printing, definitely, and it's an important part and yet unexplored.
Awesome. I think it's all the questions I've got. So is there any other questions from the participants? I think I've covered all the questions. Thank you so much, Ruchi.
Thank you. It was a pleasure being here. And it's nice to hear people talking. This is a conference I really look forward every year. And last year I enjoyed it. Last year it was the cases which I showed up, like the medical cases. But what I realized was we have people from different specialties here, like for researchers, surgeons, and then you have entrepreneurs, you have researchers. So there's no point of having just case specific things. So I just enjoyed the talk today. Yeah. Thank you very much.
You did mention that you have a book, right? So
Yes.
You might have mentioned that you might just want to do a quick plug before we get on to the next session.
Yeah, so I wrote this book just for, I was very specific about, I was understanding the problems that the medical professionals were facing. So I wrote a book which is very, very basic to medical professionals, just like a little book which they can read over the night and, just get an introduction about what medical 3D printing is, and then kind of dwell into 3D printing in their specific fields, because it's so vast for every specific specialty. But just to have an initial introduction, you can just go through the book over the night, and then you can start. So even with the printers, if I would give that book away, I mean, people would just need to know a basic of 3D printing and then start with their particular specialty. That's the reason I wrote the book. Yeah. And
okay, so everyone go and buy Ruchi's book, okay? She's you can find I've seen it on the website, so you can find it. Just Google her name.
Yeah,
thank you so much, Ruchi. It's pretty late. I'll let you get back to get some sleep.
Yeah, of course. It's 3:00. Yeah, thank you.
All right, thanks very much. Everyone else, stay tuned. In the next 7 minutes, we're going to have Alex Kingsbury and S.J. Jones to talk about the gender pay gap in AM industry. All right, we'll see you in a short bit.